Welcome back to Between Meetings and Motherhood. I'm your host, Alexa Starks. I'm the founder of Executive Moms and the editor-in-chief of Mothered Magazine. And today I have with me Crystina Hughes. Welcome, Christina.
Hello. Hello,
So,
everyone.
so excited to have you. Okay, Christina's amazing. So first of all, she's a mama, she's a wife, she's a nurse, she's a certified birth doula, she's a maternal health advocate. She is the director of community outreach at the WAWC healthcare facility in Alabama. And she's the
hmm
founder of Diamonds for Doulas. And you are being featured in the spring issue of Mothered Magazine for the amazing work that you do and your working motherhood. So welcome to the show.
Thank you for having me. That whole
Okay.
rundown I sound really important. Thank you.
You are very important, and the work you're doing is important. So I want to start with, before we get into the work you're doing now, I want to start with you and sort of like what pulled you into wanting to work in the maternal health and reproductive space? Like what have you always wanted to do that? Did you always do that? Like what got you to doing this?
So, I became a doula in 2022. Prior to that, I was a school nurse. I had school babies.
Okay.
Um, I did not think that I would actually have children. I had at that time
Oh.
a wonderful godson. I had
Mm-hmm.
just become an auntie, but I had also experienced loss,
Mm.
pregnancy loss at about 29 weeks. And so
Oh, I'm sorry.
from that experience, just sharing my experience, talking to mothers in the community, just how to advocate for themselves if they find themselves in this certain situations that I had experienced during their pregnancy, and during that loss. During that time, me and my now husband, we were engaged, but we were not married. I was in
Mm-hmm.
this transitional period at work. I did have Medicaid. I was waiting on my Blue Cross to start. Now I was in all of these transitional periods, and I noticed that the way I was treated in healthcare was very different from what I
Mm.
thought initially I would have, the care I would have, just exerting my rights that I knew I had, things of that
Mm-hmm.
sort. So I kind of got, I don't know, people would tell me like, "Oh my God, I think you should be a doula." But on the other side of things, I was a nurse, and I thought to myself like, if you have a really good nurse, you don't need a doula. But
Right.
then but I was not an L&D nurse, so not really knowing that line of work, not understanding what all goes into being an L&D nurse. You have a lot of charting, you have a lot of
Mm-hmm.
things that you're taking care of in that space, and a patient having a advocate with them
Yeah.
to help with certain things would definitely make the dream team. So I was just in a period of time where I actually had some time to be able to actually do a doula training and connect with other doulas and really connect in the community. And so I started off with Birthing by Your Design, which was my
Mm-hmm.
private doula business, and quickly realized in doing that work that the majority of the community that I wanted to serve as a doula could not afford to pay me the fee that I charged.
Mm-hmm.
So I just kept researching and came into a connection with Birthwell Partners is out of Birmingham, Alabama. I'm located in Tuscaloosa, Alabama, which is West Alabama. um, Learning about their program, working with them for a short period of time, but really wanted to bring a resource similar to my area where I live. And
Mm-hmm.
so I got funding from a wonderful organization by the name of Yellow Hammer Fund. Gave me
Mm-hmm.
a $5,000 grant. I thought I had won the
Wow.
lottery. I
Yes.
connected with two other doulas in town. I said, "Hey, I don't have a whole lot of funding, but
Mm-hmm.
which y'all want to join me in just supporting some of the moms in our area that are WIC Medicaid eligible that don't really have the extra funds to be able to have this resource, but definitely deserve to have this resource." And so
Mm-hmm.
from that conversation in 2022, we kind of just started 2023. During that year, we supported about 20 moms with doula support during that year.
Wow.
We grew during that year. We were able to get a lot more funding for 2024 and then 2025. So just kind of grew from essentially a need that I seen that
Mm-hmm.
was close to the work that I was doing, but also very rewarding in being able to support families in underserved communities, but
Yeah.
also just families that want advocacy, families that want the childbirth education. You know, there are many reasons why people decide to have doula support.
Right.
It could be for advocacy, it could be for resources, like many different reasons. So just being able to be that for expected families was very extremely important to me. So that's I fell into this work kind of just wanting to be a doula, but also I fell into the community side of doula things because I realized that what I was passionate about was serving a community that just could not afford to pay private doula
Mm-hmm.
fees.
Yeah. Ooh, I have so many questions, so many follow-up questions. Okay, where do I want to start? Okay. Are the doula services that you're doing mostly for like home births, natural births at a midwife center, or is it a doula service at a hospital still?
So our doula support initially started off as just hospital based,
Mm-hmm.
but my colleague and also chief of operations for Diamonds for Doulas, Jamila Channel, wonderful, wonderful, my heart. She is
Mm-hmm.
also a midwifery student. And
Okay.
so just being out in the community and just educating the community more
Mm-hmm.
about their options and different spaces where you can birth in,
Mm-hmm.
different options in birthing, even in birthing in a hospital setting.
Right.
We have grown. Just I know it seems like from 2023 to 2026 is not a whole lot of time, but we've grown tremendously. So we
Yeah.
are now at a place where we can support home births, or we can support
Wow.
birth center births, or we can support in hospital births, natural births, but people
Mm-hmm.
who desire to have epidural and pain management, like
Mm-hmm.
just really letting birthing individuals just take charge of how they want to birth and supporting that has been a wonderful, like beautiful thing to experience and just be a part of. And we are so grateful to be able to be beside these families in this
Mm-hmm.
space of this a space of growth, a space of vulnerability, a space where
Yeah.
very few people are welcomed into. We don't take that lightly. So we just really, really enjoy supporting the families in our community.
Oh, I love that, Christina. That's so amazing. That's so meaningful what you're doing. And I know for me, I had both my kids I did in a natural birth.
Mhm.
And I had my son at a hospital because he was my first, and I was nervous and just wanted to make sure everything would go okay. But I had my daughter in a home birth, in a water birth at home.
Mhm.
And both times I kind of trained my husband to be my doula. And I like had a whole birth plan and template, and we like practiced, little massage techniques
Mhm.
beforehand and all that. But so much of that was on me to research. Like I had to go, and it was like really intentional. I had to really research like what is a natural birth? What does it entail? What do I have to do? How do I practice? How do I prepare for that? And it was nothing that like my OB had information about. Like that wasn't the expectation. And everyone in my family thought I was crazy. They also
Mhm.
were like, "Are you sure you should do it at a hospital where it's safer?" And I was like, "No, I don't want to." Like I have, and so I think a lot of it is getting more awareness and resources to
Mhm.
women about what their options are, because you don't know where to look for information, and you don't know what's accurate, what's true, what's
Mhm.
not true. And so that's so important. And I want to touch on something that you're doing specifically, because you're
Mhm.
very intentional about centering Black women and young women, teens, and Medicare or Medicaid and WIC eligible families. It's very unique. And so for listeners who maybe don't understand the full picture of what's going on, like what realities are these families and these women navigating that the broader maternal health system overlooks or motherhood doesn't this motherhood system doesn't look out for them enough for.
Yeah, so the just the overall climate of maternal health care is at a very, very dire state.
Hmm.
So in Alabama, I think Alabama, Mississippi, Louisiana, we kind of go back and forth of who actually has the highest maternal infant mortality
Mm.
morbidity rate.
Hmm.
So and that's for anyone. And then to add a layer for black or brown women,
Hmm.
who rates go higher
Right.
in being higher mortality, morbidity rates. I have been very intentional about supporting black and brown moms because we see that's where the need is.
Hmm.
It's a need for everybody. But I think once we really dive into community doula work and how these families what they are up against whenever they come into a system that they have not been prepared for, whenever they are communicating with the provider that using verbiage that they don't understand. Um, I think for most people, they don't realize that that's harmful. So
Hmm.
we are doing the work, in our community to do childbirth education so that we can, educate our families. And we've been told, this information is going to go over their head. Well, it's our job to
Mm.
break this information down so that they understand it on their level of understanding.
Yeah.
Um, I think that it says a lot to people for us to want to reel back in our information instead of just stating the fact of if we did not have this issue of, providers coming in for a 10-minute visit and talking
Hmm.
over the patient's head, we wouldn't have this problem, right?
Yeah.
So just being able to educate the community on a level where they understand, they're able to go back and have really productive conversations with their medical providers and being able to communicate their birthing wishes, being able to communicate when and how they want to do interventions during birth. All of these things are important to how a
Yeah.
person's birth outcome can be. And so I think that when we think about the landscape of maternal health, just overall, just nationwide, we have to be really honest about that. For us to be a progressive country, maternal health is an area that has not grown much. And so, just really going back to evidence based information and being able to provide families with that information. And I think it's very interesting how you said, like, your family said, "You're crazy. You want to have a
Hmm.
baby at home?" Well, I mean, people were having babies at home before they started having them in the hospital.
I
So,
know.
so I mean, that's also a space that we are in West Alabama as far as educating, about
Hmm.
the positives of low risk birthing individuals having a low risk provider like a midwife to be their provider for their pregnancy. And then when things arise, like if you have gestational diabetes or you begin to
Mm.
show signs of pregnancy induced hypertension, or you begin to
Hmm.
show signs of preeclampsia, and
Hmm.
so on and so forth, then you start with your midwife, and then you can get referred to an OBGYN. And then we
Right.
have this beautiful case of where you have this collaborative care model where you have
Mm.
your midwife and you have your OBGYN. They're able to collaborate to give you
Hmm.
the type of birthing experience that you would like to most likely have based off of the where you are medically. So like
Hmm.
I think that there's a lot of room for us to be able to grow, but it has to be like a a piece of education where people begin to understand that it is a safe option. You know, you birthed your baby, and I'm pretty sure it was beautiful, but you you would have had, I'm pretty sure, I'm just thinking out loud for you.
Uh-huh.
If you didn't have to have those conversations to make people feel comfortable about your
Mm-hmm.
birthing choice, you would have had less stress on you to
Yeah.
just focus on getting prepared for your birth and having everybody rally around you and make you feel comfortable, instead of kind of having to
Mm-hmm.
be kind of protective over why you chose this and just
Yeah.
trying to get people to explain. So I think we have a lot of work to do as far as just educating our community about, it being a safe option if you are a low risk birthing individual.
Yeah. I love that. And Diamonds for Doulas doesn't just do doula services, right? You also do more like mentorship and
Yes,
leadership
so
and support
yeah.
networks, right?
Yes, so
Tell me about that.
we have our doula trainings and mentorship
Mm.
through the Diamond Mentorship Program. We also have our Little Ladies in Red and Maturing the Maroon Reproductive Education
Mm.
Program. Little Ladies in Red is for younger girls, 8 to 12 years old. We talk about menstruation, how to use menstrual supplies, personal hygiene, self
Mm-hmm.
awareness, self esteem.
I love
For
that.
Maturing in Maroon, that age group is 13 to 18 years old. Of course, we talk about menstruation, we talk about menstrual supplies, menstrual, well, period underwear,
Mm-hmm.
menstrual cups, menstrual discs. We talk about how to insert them properly, in self awareness, self esteem, hygiene. But also a part of that class is also safe sex. We are in
Mm.
Alabama, where we are in a state that only wants to educate our teens for abstinence only education. We have
Ugh,
plenty of
God.
research that shows that abstinence only education
Yeah.
does not keep our teens safe.
Nope.
So
It's the
we've
worst.
decided to take it upon ourselves in a state that says we should not teach our teens about comprehensive safe education. Because I mean, I want to be clear, we do talk about abstinence in our reproductive education class, but it's comprehensive. So we talk about safe sex, we talk about
Yeah.
STIs, we talk about symptoms of STIs, we talk about all of the things that come with reproductive health. So
Mm-hmm.
we have that initiative. We also have our community baby shower. Jamila is
Mm.
originally from Orlando, where she started having baby showers first. Um, we connected before Diamonds for Doulas was born. We were at a community baby shower as vendors, and we kind of bounced back and forth on, she asked me what my vision was of a baby shower, community baby shower. I told her it was pretty along the lines of what she had hosted in Orlando. So once we decided to really just put Diamonds for Doulas in the forefront of our community to support them, we decided to do the community baby shower, but we wanted it to be more than just giving baby essentials. We wanted it to be a space where families could come and get education, a
Mm.
space where it was kind of like a resource hub where families can come in contact with come in
Yeah.
contact with different organizations, different vendors that can help them along their journey. A place where they could come in contact with chiropractic care, a place where they could meet and talk with midwives, a place where they could come and meet and talk with lactation consultants, peer counselors, a place where they could come and get their blood pressure
Mm-hmm.
checked for the general community, a place where they could just come get education. This will be the second year that our county hospital will be a vendor at the community baby shower, and they're going to be
Oh, wow.
talking about their safe sleep initiative. So we're giving
Yeah.
a program that's going to be giving pack and plays will be there to also
Mm.
demonstrate safe sleep. So we're giving pack and plays, we're talking about safe sleep, we're giving breastfeeding supplies, we have someone there
Mm-hmm.
to educate about breastfeeding. We're bringing all of this education to one space. And yes,
Wow.
we want to be able to give families the supplies that they need to feel confident to start their family or add to their family, but we wanted it to be a place, a resource hub for families to come to and just be able to be connected with all of these resources under one building.
Wow. Christina, I can't, I mean, you're like an angel. I mean, like, it's so crazy the impactful work you're doing. Honestly, this is like mind blowing. Like, I wish every girl, every woman had access to these resources. This work is so important that you're doing. So, first of all, thank you for what you're doing.
Oh, thank you.
Um, and I God, this is so impactful. Okay, I want to I want to talk about you for a moment.
Hmm.
And because you're raising a child, a beautiful daughter, while
Yes.
also building an organization that supports other moms and other families. And as a business owner and mom, I understand that it's a lot of work. So I want to ask, like, what has that experience been like for you, growing a business that helps other moms and other families while also raising a daughter, building something meaningful and parenting at the same time? What's that been like for you?
So I think more importantly, in doing this work and just being a doula and being on a couple of committees is that's really doing the work in reproductive justice, reproductive education. I think it's really, really personal for me because I have a daughter. And
Mm-hmm.
so every initiative that I'm thinking of, every program that comes to mind, everything is personal in the sense of I
Mm-hmm.
have a girl that
Yeah.
one day may decide to have a family or not, but she should be able to grow into this adult that knows within herself that she has the power to make that decision and she has
Mm-hmm.
the right to make that decision, and nobody should judge her or
Right.
try to tell her how or when that these decisions should be made about her body. And
Yeah.
whether she wants to be on birth control, whether she don't want to be on birth control, whether she would like to use an emergency contraception, you know,
Mm-hmm.
all of these things that we are now in a climate of having to, decide if we're going to be fighting to keep these things
Yeah.
accessible. Um, it's been very rewarding for me because I feel like everything at the back of my mind is, do I want this available for my daughter whenever the time
Mm.
comes? And if the answer is yes, then it's
Mm-hmm.
like a, a automatic button for me to move forward. But
Yeah.
if it's like this may be harmful to young women in the future, I have to take a step back and really
Mm-hmm.
work through what that would look like for the future generation of women that's coming behind us.
Mm.
Because just in this recent couple of years, we've seen where all of the work for women's rights have somehow kind of taken several steps back.
Yes.
So just in the moment, working towards what we will want a future to look like for our girls as they mature and get older, that has been at the forefront of all of my
Mm.
work that I have been doing since before I even knew that Diamonds for Doulas would be a thing, before I even became community outreach director. Everything in my mind has been, what can we do to protect young women moving forward as they grow, especially when it
Yeah.
comes to reproductive justice.
Ugh, that's so I feel you so much, honestly, as I have a daughter too, and yeah, everything I do, I try to can I make the world and this place a little bit better for them and
Hmm.
for their experience. And so that working motherhood is seen better so that they have a better chance at success. So I feel that so much. And I know so many other moms will also resonate so deeply with that. Um, I want to ask you, how do you think motherhood has changed the way you see yourself. And, you're building something huge and you're literally changing the world for so many people. Um,
Hmm.
but how do you think motherhood has changed you and shaped you if you look
I
back?
think motherhood for me, because I was such a perfectionist, which my little daughter is a perfectionist right now, which is why reading is, a world storm to her, because it's something she's having to learn and something she's having to
Yes.
perfect. And so I think for me with motherhood, because a big part of motherhood is, whether people like to admit it or not, trial and error. I
Mm-hmm.
think that it stripped me of being a perfectionist.
Oh,
I mean, it stripped me of the performance mindset. It stripped
mm-hmm.
me of all of that, and it made me be extremely authentic. And not that I wasn't authentic before, but I just worked so hard to have this level of performance, this level of
Mm-hmm.
perfection. And now I live in a space where I know it's not going to be perfect.
Right.
Um every day is not the same. You know, motherhood is a roller coaster. And so
It
I've
is.
had to learn to go with the twists and turns. I had to learn, because I was an extremely scheduled person, that
Mm.
throw that schedule out the window. Is not
Yeah.
Every day is not going to be the same schedule.
Mm-hmm.
Um, it really just made me be in a place of just being really, really appreciative of the things that don't go right, because
Yeah.
those things are blessings too. So it just really have made me be a person of just accepting what is and moving
Mm.
on.
I love that. I found that I think I came to that realization maybe it was like a year ago now. Maybe it's a little less. But that realization of the more I stress over everything, the less I enjoy motherhood.
Mhm.
And the less I stress about, there's toys everywhere and oh, I didn't vacuum or clean up or oh, the kids schedule and they didn't nap exactly at the right time and oh, they didn't eat the right amount of vegetables and the less I stressed about everything, the better I enjoyed things. But you have to like come to that realization on your own almost
Mhm.
and figure that out. And like you said, so much of motherhood is trial and error, which is really hard, especially
Yeah.
if you're not used to trial and error and failing and trying and figuring something out as you go. That's a really hard, it's almost a skill you have to learn.
Oh yeah, definitely. And I feel like society doesn't make it any easier. You get
No.
on Facebook, everybody has these
Mm-hmm.
expectations of what you're supposed to be as a mom. Are
Yes.
you a crunchy mom? Are you a career mom? Are you this type? Like, all of these different labels of
Yeah.
what motherhood is supposed to look like. And like, we host a monthly support group with Diamonds for Doulas for breastfeeding and postpartum support. Very
Mm.
just, it's it's just group led, like
Mm-hmm.
very not structural at all. But I think our conversation yesterday was very important. And we had, at this group, we just had expecting moms, and we were talking about, like motherhood goals or core values, whatever you want to call them, and just how you start motherhood off with all of these things and expectations on yourself. And
Yeah.
my thing was, I remember my thing, everything. I was gonna make baby food, breastfeeding. She was not going to. She was not going to be a kid that snacked. She was going to eat
Yeah.
healthy snacks, no fruit snacks. Well, I she loved fruit snacks. That's something I just had to
So
like
funny.
just conform to. And
Yeah.
I wasn't even the person that gave her fruit snacks, and I had to get over that too. But I think like even something that small for
Mm-hmm.
moms, it can turn into just a lot of mom guilt, because initially you didn't
Yeah.
see it that way. And so one of the things that I have been working really hard in my community to just uplift moms is just respecting that the
Mm.
mom you are and the mom someone else is may not be the same mom, but it does not make you or her above the other or below the.
Mm-hmm.
All of us have
Yeah.
different goals for motherhood. All of us have a different idea of what type of mom we want to be, and just
Mm-hmm.
common respect for how you mother and how I mother is really all that we need to have amongst each other to support each other. So I feel like
Absolutely.
that's one of the biggest things. I think the pressure, the societal pressure that's put on us as moms, that we have to support each other through that, because that's ultimately what's extremely important.
Yeah, and you don't know what kind of support one mom has versus another, and you don't know how someone's postpartum is or their birth experiences. Every single thing has such an impact on their motherhood journey, and you don't
Mm-hmm.
know. Like, I thought breastfeeding would be so easy, and with my first it wasn't. He had, like, we struggled getting him to latch, but with my second she latched like right away.
Mm-hmm.
And but it didn't like we didn't end up getting to feed that long because she had reflux. But it was like, you don't know what someone's going through, and so I completely agree. It's so hard to compare yourself to other moms, and it's just so detrimental on yourself and your self-esteem and your confidence, because motherhood is hard already without comparing yourself to other people, to other moms. And the better thing to do is just share advice, share support, be supportive,
Mm-hmm.
and be there to cry it with when it is hard, and that you'll get
Yeah.
through it. Yeah, I love that. Okay, I want to talk about legacy building, because this is such an important part of working motherhood and strong working moms, and what you're building and what you're doing. And you've talked about before and in your interview that building a legacy means both at home and in the
Mm-hmm.
community. And so when your child, when your daughter grows up and looks back at this season of her life and of what you're doing, what do you hope she understands about what you're doing and why you choose to do this work?
Um, I hope she understands that everything came from like a good place.
Mm,
A place of wanting to support, a place of wanting to pour back into my community, just a good place from inside of me. And then she understands that it was born out of authenticity. Is that
hmm.
a
Authenticity.
yes, that word.
Yes,
Um I
I love that.
that's the main thing I hope she looks back on. I mean, she's baby doula, so she understands birthing position. She wears her baby doll, like
Oh,
how I teach my
I
client
love
about
that.
the doll. And so I think she's picking up on what I'm trying to instill in her. It's
Hmm.
just always showing up to be yourself. Regardless of what she wants to do in life, just make sure you show up and you're you,
Hmm.
and you have pre-intentions, and you want to be there to pour back into your community, because
Mm.
excuse me, she's with me in the capacity of a community outreach director. She's with me when we're doing food drives. She's with me when
Oh.
we're giving food for Christmas, for Thanksgiving.
Hmm.
She's with me at the community baby shower. So I think for me, just instilling in her that no matter what you decide to do, in whatever capacity, just please pour back into your community, because that is what's most important.
I love that. I love that. That's so good. That's so beautiful. Okay, before we wrap up, I want to side pivot to a random question.
Hmm.
Did you have a doula for your birth of your daughter, or were you your own doula?
No, I did not have a doula, but my lovely bonus mom was my unofficial doula. Um, a little bit about my birthing story. Prior to, I had a loss at 29 weeks. So
Hmm.
going into this pregnancy with Taylor, I knew it would be high risk. I knew that interventions would be involved, but I also knew
Mm.
that I would do a natural labor for as long as possible.
Mm. Mm-hmm.
So, my bonus mommy was there making ice packs, making heat
Yay.
packs, walking with me, massaging me.
Mm-hmm.
I did eventually get an epidural.
Mm-hmm.
About 15 hours in. Taylor was literally born
Wow.
45 minutes later.
Wow.
Um, I thought to myself I could have avoided the epidural, but I got the epidural. I took a nap, then I woke up and I had a baby.
Oh,
But
wow. That's a good
I
nap.
think that hindsight, looking back on my journey through pregnancy and childbirth, is where I really poured into building the different programs that I have that are part of Diamonds for Doulas, and just
Mm-hmm.
even being a nurse, there was a lot about childbirth education that I knew a little bit about, but
Mm-hmm.
I thought back and said, childbirth education class would have been very important for me.
Mm-hmm.
Having a concrete birth preferences sheet would have been very
Right.
important for me. Like, all of the different components that I personally felt like would have been
Mm-hmm.
important for me and would have helped me facilitate a better birthing experience. I poured that back into my organization. So, but no, I didn't have a doula, but I was told that during that time, that was during the time when people were telling me I should be a doula, because I've just always been really connected to evidence
Mm-hmm.
based information. I've
Mm.
always been connected to wanting to have the naturalist form of birth and wanting to be in charge of my birth, wanting to be able to say what I did and did not want. So I think that, like, being a doula came very organically to me, just because of the things that I was connected to, but
Mm-hmm.
also just being able to go back to a place of vulnerability and just realize that there were a lot of things that I could have done differently,
Mm-hmm.
and knowing what I could have done differently and putting that forth for another family to be able to have those experiences was, like, extremely important to me.
Yeah. I love that. Okay. Thank you for that, for indulging me in my little side quest pivot. Okay. All right. As we wrap up, I want to ask you, for some of the other moms who are listening who really feel what you're building, that how you're building something so meaningful and impactful while also being fully present as a mom. What's your biggest piece of advice to doing that?
um Again, being authentic. um on the days you wake up and you feel like you can only get two tasks done, do them and move on.
Mm,
I think so much of society standards have us feeling like that we have to be super mom at all times. I mean, we have to
yeah.
have a baby. We have to go back to work in 6 weeks. We have to take care of a family. We have to
Yeah.
do all of these things. And I feel like just being true to yourself and saying, today I'm doing these two tasks on my to do list because that's all I have capacity to do.
Mm-hmm.
And giving yourself grace and just standing with the grace that you have for yourself and extending that grace to other moms around you as well, because I feel like just building a circle of community that understands and respects each other as moms is important as well. But I feel like just being authentic to how you feel, knowing your capacity is the main thing. What you have the
Yeah.
capacity to do today may not be what you had the capacity to do tomorrow, and that's
Yep.
completely okay.
Yes. Oh, I love that. And I feel that so much. Some days my toddlers are sick and they have to stay home and I can't get as much work done. And other days they're at daycare and I can get a ton of work done. And it all balances out. And sometimes you have that pull that you have to do so much every day because society kind
Mm-hmm.
of conditions us into thinking we must do everything at 100% every day. And we don't. So I love that.
Nope.
Thank you, Christina. Thank you so much. And okay, where can we find you on your online, on your website, on social media?
So on Instagram, I am Chrissy Babe. But Diamonds for Doulas on Instagram, Diamonds for Doulas on Facebook, Diamonds for Doulas on LinkedIn.
Fabulous.
Um, And you could just, for moms that are, really going to follow me through this journey, I will be releasing a book, Black Maternal Health Week. So look out for that.
So exciting. Oh
Yeah,
my
that book will
God.
go
Congrats.
into, I'll talk about my loss. I'll talk about my journey to, building this organization. I also talk about postpartum and just
Mm-hmm.
really the process of how I've come to the mom that I am today, and really just being like, excuse me, I don't really care what y'all think about me as a mom. I am a good mom, and I could care less what anybody else thinks. So
Mm-hmm.
that's my process of coming to that. So
I
I
love
will be
it.
keeping everybody updated for the launch of that book.
Yes,
And
I love it.
it's
We'll
it's
we'll
by
link.
the title of My Calling to Help, and help is HELLP, from Help Syndrome. So just be on the lookout for it. I'm so excited.
I love that. We'll link to all of your socials in the description. So if you want to learn more about Christina and find her online, please look in the description and read more of Christina's interview and look at all of her beautiful, fabulous photos in the spring issue of Mothered magazine. By the time this comes out, it comes out the same day as it's going to be released. So March 31st. If you're listening to this, it's already out. So go to motheredmagazine.com and you can read more of Christina's beautiful article interview. And Christina, thank you so much for joining us on Between Meetings and Motherhood. It's
Thank
been an
you so
absolute
much for having
pleasure.
me.
And the work you're doing is so meaningful and so impactful. So thank you. Thank you so much for what you're doing.
Thank you for having me. I'm really excited about this.
Yes, absolutely. And we will see everyone in the next episode.